Democrats fighting for the so-called public option or government-run health care. Our next guest has been vocal about this. Democratic New York Congressman Anthony Weiner joins us right now. Good morning to you, Congressman. All right, so you have said, look, President Obama, you're going to lose 100 votes if you do not keep the public option intact. You still agree with that?
Well, look, we need some competitive pressure to bring down prices. Glenn Beck was pointing at the screen showing how much unfunded health care mandates are going up. Unless we do something to get those costs under control, frankly, we're all going to be going bankrupt, and all of our policies are going to get more and more expensive.
Congressman, the problem with that comment is doing something. When you take the government option, you're doing everything. Because bottom line is, when you put the government option in there, it's cheaper. People will emigrate to that, and there's really, you're going to completely take those current insurers out of the game.
Yes, citizens are going to make a choice. If you don't trust the free market and you don't trust citizens to make the right choice, then yeah, you're not going to like that idea. But I thought we believed in the idea of giving citizens choice. If they don't think they're getting quality, they don't want government control, then they won't choose it.
What if your company, who gives you health care insurance, which you know happens more often than not, says, you know what, I'm looking at my budget. I'm going to go the public option because it's cheaper. The quality might not be as good, but when I come to balance my books, I'm still offering my people insurance. The quality is dropped, and I save some money.
Prohibited under the plan. Under the plan, for the first 5 years, your employer not only has to keep the coverage, but you can't migrate to the public plan. The concern was we didn't want a giant movement. Now, I frankly, you guys have probably seen me elsewhere. I believe in a completely public plan. Medicare is a program that we have for 65-year-olds. Why not for 55-year-olds? Why not for 45-year-olds? But putting that aside for a moment, the bill prohibits that mass migration the first 5 years.
But what about the next 5 years?
Well, here's what will happen.
Be around in our generation.
Here's what will happen. In order to make sure no one tries to freeload on this thing, any employer who has insurance now offers insurance is going to have to keep offering it, or they're going to get sanctioned. We don't want Fox News offering great health insurance, but NBC deciding, you know what, I don't want to, and dumping it on the taxpayer. That's not going to be permitted.
Yeah, but after the 5 years, those private offerings are going to go bye-bye.
Well, wait a minute.
The cost.
Now, why?
Because
why is their cost higher? Well, let me answer the question for you. They're higher because they have about a 30% overhead and profits. Because right now we're giving insurance companies the money and say give it to our doctors, and they're taking a little piece of the action on every transaction. Why are we funding that? I'm not here to defend the shareholders of insurance companies. I'm here to defend the stock price.
Here's the problem. Right now, healthcare represents about 16, maybe 17% of the economy. Do you really want the government dictating 17, 18, 20% of the economy?
Let me ask you a question.
If the 47, whatever the numbers, 22 million additional people come on the public.
Well, let me ask you a question. Right now, 40% of all of our tax dollars are going to a single-payer, government-funded, government-run health care. Medicaid, Medicare, DOD, Department of Veterans. Hold on, let me answer the question. And if you don't like those programs, go tell senior citizens and go tell Michael Steele, hey, that doesn't work. Government-funded health care is so wrong. The only question we have here is who are we going to give the money to pass it through the doctors? Are we going to give it to someone who works for us, or give it to shareholders?
I appreciate, by the way, you answered his question with a question, so we got to move forward here. Here's what you say. I appreciate the research you put in and everything like that, but there's nothing good financially coming out of Medicare. If the seniors are happy about it, I have bad news for you. They haven't done the math.
100%
We're left with the bill.
100%
so
right.
it's not paying off. So why expand that?
Good question, but here's the question. We have a financing arc, whether it's in private health care, which is going up more than Medicare, and in Medicare. I don't dispute that. Now, I noticed the Republicans are like, oh, don't cut any of the waste out of Medicare. Well, I disagree with that. I think we should.
Anti-waste.
No, they put out a statement that said don't cut anything out of Medicare. Well, how are you going to control costs if you're not going to cut anything out of Medicare? There are some things you're going to have to do to cut down on waste here. But the point is very simple. It's not whether or not we have to get costs under control. It's how you do it. Do you do it by giving $300 billion to shareholders, to profits, and to overhead, or do you put it back into tax cuts and the treasury?
Here's the problem. There's a thing called history, and people have watched how the government has spent their money before, and they've seen that it hasn't been spent very well. And now they're looking at recent history with cash for clunkers, and they're saying, holy cow, the government can't run cash for clunkers, which is a small but tiny piece.
Well, let me ask you this question.
To what
Do you think
would
Medicare, for its 44 years, has been a successful program?
not if it's losing money.
Well, let me hold on a second now. You ask the people that are on it, and ask all my Republican friends who are now thumping their chests, we've got to protect Medicare.
Congressman,
Medicare works.
That's a good point. And my mom, for example, is happy with it. However, but the fact is that doctors and hospitals are not able to continue to exist under the current rates which they're being paid. They're being paid 30%.
Wait a minute. Is Medicare costs going up too much or too little? I can't understand your argument.
What do you mean by that?
Well, you said that Medicare costs are going up too high. Now you're saying the reimbursement rates are too low?
I'm telling you it's wrong on both ends. I'm telling you the people that are getting the service are happy they can walk in and out.
Correct.
But the bottom line is we're left with the bill at the hospital. The doctors aren't getting paid enough. The hospitals aren't getting paid enough. And this way they're going to hit a so-called wall or mountain.
Okay, well, we're also reimbursing in Medicare. I want changes to Medicare. For example, we will pay $700 to put someone in a hospital bed, but we won't pay anything to have a home care attendant for a fraction of that price. There's no doubt about that. But you're making exactly the contradictory argument that many on the right are making. They say we like Medicare, but we want higher reimbursement rates. Well, the high reimbursement rates, it's not going to come. Here's the deal we're going to make with doctors, and we've always made it on Medicare. You get this giant pool of reliable patients coming to you, and the government's going to be efficient, only a 4% overhead. Let me finish my thought. 4% overhead reimbursing you. But you know what? We are going to try to contain costs. The only question is, does Medicare do it better than private insurance? And the answer is clearly yes.
But if this were such a strong selling point, then why is the president not backing the public option?
Well, look, the president, I would like him to be clear about what exactly he wants. He wants us in Congress to draft this, and he's going to say, let Congress do its job. I think it's got to have a public plan, and frankly, they've been in a couple of different places. I think they prefer a public plan as well. But I want to tell you something. If you don't support the idea of having a public plan compete, what do you support to try to control health care costs? What do you on Glenn Beck's board, and how you do it?
Well, I'll answer you. How about allowing states to compete across lines? How about if I like a great policy?
Tort reform?
Let me give you both. Let me give you an answer on both. First on tort reform. I am fine having some conversation about how you do tort reform. Right now we have 5 states that have caps. Not a single one of them have insurance rates go down. Not a single one. You know why? Because the insurance companies are phonies. They get the cap and then they pocket the money. On the second point, allowing them to compete over state lines, very often, here in New York, we have a lot of companies there are a lot of parts of this country that there are not companies rushing to get in, but even if you did, they take a little piece of the action on the rise in rates. They don't have the incentive to save money. We, the taxpayer, do.
All right. No doubt a very interesting debate, and we thank you so much for being our guest this morning, Congressman.
Thank you.
Good to see you.